us today. And with that, we're going to wrap up this symposium. We have some final closing remarks from our advisory board, or three of the members of our advisory board, starting with Associate Professor Anna Nilsdotter, who is the head of the Department of Orthopedics at Sahlgrenska University Hospital.
Thank you, Max. I'm so grateful that this collaboration between Chalmers, Sahlgrenska Academy and the Sahlgrenska University Hospital is realized. The Department of Orthopedics at Sahlgrenska University Hospital has been engaged in osseointegrated surgery since the late 90s, when the Brånemark system was introduced, as we heard earlier today. We have treated patients from all over the world and have a great experience of these patients who, despite complications, are very satisfied with their implants. In the future, I hope we will be able to help and treat even more patients, and hopefully not only those who are traumatically amputated. The collaboration in CBPR will be crucial for the development of new surgical techniques and new ways of giving treatment to our patients. There will also be big opportunities to start research projects in collaborations with the Department of Orthopedics that are really important for our patients. Thank you very much, Max, for having organized this very important meeting and for making it possible for us to come together. We look forward to spend time in this house together. Thank you.
Thank you, Anna. Likewise. And now we have Dr. Carina Reinholdt, who's the head of the Hand Surgery Department and the Center for Advanced Reconstruction of Extremities at Sahlgrenska as well.
Thank you, Max. It's been a few years since we started to collaborate, and Max was running forth and back at our department, and I offered him a room where he could fit like 4 researchers into, I think. But it only took a few months after when he came and said, well, can I move my whole department into the hospital? And here we are, making it reality. And I really think this is going to be a difference for the future. I do reconstructive surgery myself. I see patients with tetraplegia and spasticity. And we've had a lot of help from Promobilia at our research. And we hope that we can be able to give these patients even more better options, and both in rehabilitation and in surgical matters. We hope that we will be able to give these patients electrodes when we cannot move nerves or cannot move tendons and muscles anymore. We see patients with even higher injuries today, and we really hope that this will make a difference. I got a lot of new ideas today from the conference, which I think will enhance our collaboration even more. So we're really happy to be able to have the center finalized and be able to continue collaboration, and hopefully we won't see any more COVID patients, so we'll be able to offer you some overtime also. Thank you.
Thank you. So last but not least, we have Dr. Peter Dahm, who's the head of the Anesthesiology and Intensive Care Unit at Sahlgrenska University Hospital.
Thank you, Max. Dear Max, so great to stand here today and to be part of this first CBPR Congress meeting. My name is Peter Dahm, as Max told you. I'm acting head of the Department of Anesthesia and Intensive Care here at the Sahlgrenska University Hospital. My department has worked and researched in the field of pain for many years. Pain is one of our most common clinical symptoms, and it's also one of our most costly diagnoses in society. Pain is a very exciting and interesting clinical area, but above all, very difficult due to its multidisciplinary nature. It is a field that you cannot work alone individually. You need to address it jointly, professionally in teams. I see great potential to do so with you, Max, in the CBPR. Together, Sahlgrenska and Chalmers University have great opportunities to get far in the field, and I look forward to participating in the future research. Phantom pain is of particular interest, as no standard treatment seems to be better than any other one, including the well-known methods we use today, as nerve blocks, pain pumps, opioids, anti-neuropathic, and anti-inflammatory drugs. With the new technology and method that CBPR uses to relieve phantom pain together with artificial intelligence, I see a very bright future for this patient group. The CBPR's point of attack for treating phantom pain is fantastically innovative. Treatment of phantom pain without giving patients strong drugs with well-known side effects, as well as working with brain plasticity, is the new state of art, I would say. It is a clinical, fairly unexplored area, and that I believe we have great potentials in the future to develop new treatment methods together. I believe that together and by combining our clinical experiences, we can contribute to increase the quality of life for this severely affected patient group. So, Max, I'm very much looking forward to your cooperation in the coming years. Thank you.
Thank you, Peter. Well, thank you very much. So it has been a long journey to establish this center, from the idea until we get the grant approved and getting all the paperwork, because these are big institutions that need to agree. Even if everybody agrees, things need to be signed. But it took only a year to set it up. But now it's done, and we're really happy to be here, and we're looking forward to this. So many ideas. We might need more rooms though, because we have more people interested to join us, which is a good thing. So it was a bit challenging to organize this meeting as a hybrid event. As you know, some of our speakers had to cancel last minute and so on. But we all been running around, so I would like to say thank you to everybody in my group. They've been helping, Eva and Jan with the questions, and everybody else with the organization. Clancy Carlson, who is probably fixing some other stuff for the thing that is up to come. So everybody, I would like to say offer an applause for everybody that helped us to organize this. And the Chalmers Foundation, they awarded me a prize last year, and with that came an amount of money that made this possible. So that's also very important. So thank you very much for everybody who joined us online. I'm going to look at the camera, I think it's that. Thank you for everybody that joined online. It was, I hope you enjoy it. Most of the talks will be available online later on, so you can revise them if you don't have enough time. So thank you everybody for participating, and that concludes our first symposium. Thank you. Bye.